Hi, it's Nurse Allen. I'm back to you this morning
going over skills
with
today.
going over
And the
videos
first skill we're
on
going to
how
go over
to
is
apply
how
TED
to apply a
holes
TED hose.
for
I will
headmasters
go
in
through each
Michigan.
step
I will be
as
going
you
over
should
each
perform
skill
it
that we have
for
here in
your
Michigan.
test
We have
proctor to be
17 testable
successful in
skills,
passing
but
your
I'm going to be going over
HeadMaster's
each one step by
TMU
step so that you
CNA
are
skills exam.
successful
So I'm going to
when
go
it comes
over
to
step by
headmaster
step.
testing.
So the
Now,
first
when
part of your
people come
skill is
in,
knocking on the door.
sometimes they
So
come from
I'm
different
trying to make it where
schools,
you can see everything.
and they were taught
So I'm going to
different
knock on the
methods.
door.
But however, Headmasters
Good morning, Miss.
online
Good morning, Miss
has
Allen. My name
a
is Tanita. I'll be
site
your
where
CNA
you go
today. I'm
on
here to
DNS
put on your TED hose. Is
TMU
that okay?
Headmasters,
The patient
and you can
says
go
it's
on there,
okay.
and
So
they have the
she's given me permission
steps
to put on her
that
TED
you
hose.
can
So the
use
first thing I'm going to do
that you can be
is apply my
successful,
hand sanitizer.
and that's what you're going by.
One of your
Now, I know it's a lot of
skills, how
videos
to
out
apply
there,
hand hygiene
but I am a test
until your
proctor
hands
and
are
I am an
completely
instructor.
dry.
So
My
I
hands are
go
dry.
over the
I'm
skills
going to
to
now
make sure
provide
that
the
you are
patient with
successful
privacy. But
in
for the
your
video
first go
purposes, I'm
around
going to leave
in
the
taking
privacy
your
curtain
skills
open so that you
exam.
can see me
So one of the
actually
first things that they
perform the
want
skill.
you to do is hand sanitize.
So now that we got her,
you're going to
in
use
the
your
bed, the
hand
next thing, what am I
sanitizer.
gonna do? I need
So
my
I'm going to be
supplies.
going over each
So
skill,
I have her bed,
and I'm going to be
bedside table. I'm
showing
gonna
you
move that out because
how
I
to
need this
perform
space
them
to
so that you
utilize.
are
I'm gonna
successful
start
your
from
first
the
go
head
around. So you're
foot of her
not paying
bed
that
because all Miss Allen
175
needs is
2
her
and 3
foot to be
times,
exposed
because I see
so
students
that
all
I
the
can
time that say I
perform
took
this
it
skill. So
several
I'm gonna
times.
go
I
get
don't know
my
what I
TED
didn't
hose.
do. And it's sometimes that we don't
So
pay
the
attention to
skill
what
is
the
only
proctor is
asking
asking
for
you.
one TED
She's
hose. So I'm gonna
asking you
say,
questions.
apply
Well, it's a scenario that she
anti-embolism
reads to
stocking.
you.
Now,
And you
to
are
go
to
back,
follow that
the stocking
specifically,
has
because
several
remember,
names.
testing is all
The
about care
stocking
plans.
goes by
In your
elastic
teaching,
stocking,
we talk to you about
compression
care plan.
stocking,
Care plan
TED
guides
hose,
you
or
on how you're
anti-embolism
going to
stocking.
take care
You
of
may
that
see this
particular
on your
patient.
test.
So that's
In
really
the book,
what
it's
the
called
proctor
an
or test
anti-embolic
observer is
elastic
giving you
stocking.
is
So that's
a
the
test
name of it in the
scenario
book.
in
So
a
this
care
is what
plan
they're asking you to
formula.
apply.
So
One
we're going to
elastic
go through
stocking
that,
to one
and I'll be
foot.
back to show you how
The
to do your
proctor
first
will
skill.
tell you the right or the left foot, and at that time, that is the skill that you will execute. So now that I've washed my hand, I've already did my hand hygiene. I've gotten the supplies that I need for that skill, which is only a TED hose. So now I'm only going to expose the one foot because my test observer only asked me to apply it to one foot. So the first thing I'm going to do is make sure my bed is at a nice working height. I'm going to make sure that the bed is locked before I start the skill. Now, the next part of the skill is I'm just going to expose her one foot. Okay, Miss Allen, I'm just going to expose your foot so that I can put your stocking on. So at this time, I'm going to have her one foot exposed so that I can apply my stocking. So now that I have her foot exposed, these stockings are extremely tight. So I always tell my students to stretch them out so that you can get some of that tension off of it, so when you're applying it, it's not so hard. So the next thing I'm going to do is I'm going to turn the toe box towards me, and I'm going to gather the stocking up. As I'm doing that, I'm stretching it to make it easier for me to work with, because this is to help the patients with circulation issues. So if they have any swelling on their feet and their ankles and legs, this is what they are for. So trying to put these on is going to be extremely difficult. The mannequin, not so much, but sometimes it's tight for the mannequin. So I stretch it to make sure I got all of that give off of it so that I can put it on a little smoother. So next thing I'm going to do is I'm going to talk to Miss Allen, and I'm going to let her know that I'm applying her TED hose. Okay, Miss Allen, I'm about to apply your TED hose. So it's going to tell me to apply her TED hose to make it go on nice and smooth. I'm going to take it all the way up her leg until it's smooth and wrinkle free. Your test question, the test on your HeadMasters in the mock skills, on there it asks in bold print. Anything in bold is really important to make sure it's done. It says on there that it's smooth and wrinkle free. So at that time, I would tell my test observer proctor that my stocking is on the patient's foot, smooth and wrinkle free. Once I do that, complete that portion, I'm going to put the cover back on the patient. I'm going to fix my bed. I'm going to miter my corners or make hospital corners, whichever one you prefer to call it. And then I'm going to make sure the patient has her call light. Miss Allen, here's your call light. You need anything else? Magazine, some water. Okay, I'm going to put your bedside table back next to you. And I'm going to open up her privacy curtain. Now the next part of that skill, at the end, you want to make sure that you hand hygiene. So I'm going to hand hygiene again. Then I'm going to step back, look at my environment, make sure everything was done. So at this time, I'm going to always go through my skills and triple check myself to make sure I did everything that was required of that particular skill. Before I tell my proctor skill complete, I'm going to make any corrections that I need to do. So I'm going to walk myself through. Did I knock on the door? Did I announce myself? Did I tell the patient what I was doing? Did I do my hand hygiene? Did I provide her privacy? Now, what was the skill? The skill was to apply elastic stocking. Did I follow the steps? Yes. I hand sanitized. I went and got the supply. I went and got her anti-embolism stocking. I applied it to the foot that the proctor told me to put it on. I made sure it was smooth and wrinkle-free. Then I would just make sure I did everything. I opened up her privacy curtain. I did all the necessary steps. Then I'm going to look at my environment. You want to make sure the environment is inviting, although these are not necessary for the test. I just like to inform you that the reason you're doing everything is to make sure you don't have to come back in that patient's room for 2 hours. But for testing, the only thing that's required is to make sure that it's on, smooth, and wrinkle-free. And after I do all of that, make sure my environment is together, I'm going to tell my proctor or test observer my skill is complete. And then that would conclude that particular task, and then you would move on to the next task. So I will be coming to you with more videos, and just stay tuned because I will be doing each and every video for each skill that we have to perform. Take care.